Here is going to be a very introductory session where we'll just go through what fields artificial intelligence already penetrated into, and if artificial intelligence is a hype, a help, or a harm. So we'll begin by looking at two graphs. So the first graph we see here is number of machine learning papers that have been published in medical image analysis. So medical image analysis is only a small part of medicine, and even in that small domain, we have so many papers that have been published in the recent years. So if you look at the trend, that we see that it's increasing exponentially. And the second graph is depicting the number of approved AI/ML devices over the years. So all of these are FDA approved devices, and we see a similar trend in the device category as well. We see that after the year 2019, there are more than 100 devices being approved every year. So from this, we see that AI is increasingly influencing diagnosis, treatment, and monitoring in healthcare. And we see that there are over 100 AI/ML approved devices since the year 2020. And we have to keep in mind that AI is not a single entity, it's actually a collection of tools. So all these tools together contribute towards what we call artificial intelligence. So what is artificial intelligence? Artificial intelligence is a branch of computer science that involves creating computer systems that are capable of performing tasks that would typically require human intelligence. So how it differs from traditional softwares is that traditional softwares have a predefined set of rules. So it will have strict rules as to how to deal with already predefined situations. But how machine learning or artificial intelligence differs from this is that it will be able to learn. As we give it more data, it will learn the rules by itself. We do not have to program each and every rule. And we commonly come across terms such as ML, deep learning, NLP, computer vision. So expert systems are what we call these traditional programs. All the rules are predefined by an expert in the domain. ML is short for machine learning, which is the foundation of AI, you can call it. So what the computer does is it will learn patterns from the data that we provide without explicitly programming the rules. And then we come across deep learning, which is all the hype nowadays. So deep learning is actually just a subset of ML, where the learning architecture is influenced by our neuronal structure in the brain. And it has many layers, and it is able to understand deep, complex patterns. So that's why we call it deep learning. Then we have NLP, which is short for natural language processing. It just deals with the part of AI that deals with understanding language. Computer vision is again a part of AI which deals with how computer program sees images, and it tries to replicate how humans look at an image. Rather than looking at it like pixels and gradients, it tries to identify objects, and similar to how humans view an image. And one reason why machine learning is becoming popular nowadays is because of the importance of evidence-based medicine nowadays. As all these ML programs, they are data-driven. So that in turn is evidence-based medicine. Then we'll look into what the different types of machine learning that we have. So machine learning is, again, as I mentioned, it's learning pattern from data. This data can be labeled or unlabeled. Broadly, we have three types of machine learning algorithms. So we have supervised, unsupervised, and reinforced learning. So what supervised learning is that it identifies the patterns from labeled data. For example, if you have a pathology slide, we'll tell the computer that this is in the data set, we'll have a label attached to the image of the slide. So the image will be there, and beside it, we'll have, let's say it's meningitis. So it'll have a tag that it says it's meningitis. So the computer will be able to learn the features of meningitis from the image. Then we have unsupervised learning, where the images won't be labeled. We'll give it a whole bunch of images, and the computer on its own tries to come up with algorithms or patterns, and then groups similar images together. So if the grouping is good, if the let's say we have three diseases, meningitis, we'll take the same example of pathology. So let's say we have meningitis, gliomas, and benign tumors. Then computer, if we give it data that includes all these three types of images, it will group all the images into three subsets. And if all the subsets are tightly grouped, it's able to identify patterns that are there in each group, then we call that a successful learning. Then we have reinforcement learnings, which actually is a trial and error method of learning, where the computer will try different approaches, and whenever it achieves the desired outcome, we'll reinforce that method. So over time, it comes up with the best method. Then we have deep learning. So if you look at the two pictures here, the first picture is the cross section of the retina, as all of you would be able to identify, and second is again a neocortex, the cross section of the neocortex. Now, this is an architecture that we use for deep learning. So if you see, you can see the similarity there. That's why we call it neural networks. So these kind of architectures that we use in deep learning are called artificial neural networks, in which each of these layers are called neural layers, and they are organized into an input layer that is in the beginning, and then we have hidden layers, and then you have an output layer. So we give the features we have identified in the data as input layers, and the model will identify weights to each of these features, and it will cross-link with all the different layers, and then finally, if it's a classification problem, as in we have three different types of disease, and all the three different types will be the three outputs, and according to the input that is given, it will go through all the weights and be sorted into the correct output bin. So a loss function is the function is the measure of how much the prediction deviates from the actual value. So that is how we would train a model. We train a model to minimize the loss function. So if we get minimum loss, then it is a well-trained model. Before we get into the AI applications in the different domains, at least some of you might have seen this post on X by Dr. Rajesh Bayana. He is an abdominal radiologist, and he's also an assistant professor of radiology at the University of Toronto. So, how many of you have not seen this video? Can I get a show of hands? Then we'll go to the link and look at the video once, because it's very interesting. Can I get 1 minute? I have to set up hotspot. Sorry about the delay. Sorry about that. This is a video that Dr. Rajesh had posted.
Hey, what do you see? Can you describe what this scrolling through right now?
So he's asking Gemini.
CT scan of the abdomen. It displays the liver, stomach, and surrounding structures.
What organ am I pointing to now with my cursor?
You're currently pointing to the spleen with your cursor.
Okay, Gemini, what am I pointing to now?
You're now pointing to the liver.
Okay, so I'm scrolling down here now. Gemini, what am I pointing at now? What organ is this?
You're now pointing at the pancreas.
Okay, and do you see anything abnormal on this scan?
Yes, there is a small amount of fluid around the spleen and the pancreas on the scan, which could be a sign of inflammation or injury.
Okay, anything else that you notice about the pancreas?
Pancreas appears somewhat swollen, which could suggest pancreatitis.
Okay, the patient has an elevated lipase level. What do you think about that?
Given the elevated lipase levels and the appearance of the pancreas, it is highly suggestive of pancreatitis.
Okay, what complications should I be looking for?
Based on the scan, you should be looking for complications like pancreatic necrosis, pseudocysts, and infection.
So that was the end of the video. The second voice that you heard in the video was not a doctor, it was an AI. It was a Gemini 2.0, which is a AI program by Google's AI program. So he was shown this video right out of the gate, and it is able to answer such medical questions. We have to keep in mind here that Gemini is an all-purpose AI. It's not one AI that is strictly specified for medicine. So you can only imagine what AI that is strictly trained on models or images in medicine will be able to do. We'll go back to the PowerPoint now. So initially, we'll look at AI in radiology, since radiology is the most mature domain in which is using AI. So it is very prominent in AI because the image or the computer or artificial intelligence is able to do image classification, image detection, and segmentation tasks very well. At least, even better than what a human will be able to do. So, what is image classification? So, when you give a computer an image of a cat and you ask it if it is a cat, if it is able to say yes or no, that is image classification. And if it is able to detect the cat in the picture and identify, say this is a cat and this is a dog and it's located in this part of the picture, that is detection. This is very useful when it comes to tumor location, localization and such. And then we have image segmentation, which will actually identify all the pixels that belong to the specific object, which is very important in identifying the size of the tumor, planning treatment and such. We can also use AI in radiology for real-time triage of emergencies, which you will see in the next slide. In this one, this is an AI called Rapid AI, which has a neurovascular model which can identify stroke. It can identify hemorrhagic stroke, ischemic stroke, and even aneurysms which might pose a threat during intervention. It can give you pneumothorax alerts from just CT or X-ray. Then we have screening programs which can actually detect foci, cancerous foci in mammography scans. So if you look at the second picture here, that was published by a research team from MIT. So what they saw was this: the picture on the left was published 4 years before the picture on the right, was captured 4 years before the picture on the right, and 4 years before there was an actual nodule. The AI was able to correctly predict that this might be a focus of developing cancer. We can also use AI for CT, MRI segmentation and workflow prioritization, like we saw in the previous examples. Then the next field where AI has major footfall is pathology. So since 2017, we see that there have been many programs, AI programs that are developed for pathology. That is because FDA approved whole slide imaging in 2017. So what whole slide imaging is, if you give it a slide, the computer program or these whole slide imaging systems such as this is able to capture the whole slide and create a digital copy of the same. Each image will be 2 to 3 GBs in size, because you have to get at least 40x magnification and you have to cover the whole image. So that is why it was difficult before, but now after whole slide images are becoming more common, AI in pathology is gaining importance. Another example of an FDA cleared FDA cleared AI program is PAGE prostate, which can identify prostatic cancer from histopathology slides. It can also do quantification of biomarkers and find histological patterns which might be missed by a human observer. Then we have AI in ophthalmology. This IDXDR is a program, was the first autonomous AI program that was approved for ophthalmology, and it is able to very helpful in the early detection of diabetic retinopathy. Now they are actually improving it further to also include AMD, glaucoma and ROP. ROP is retinopathy of prematurity and AMD is age-related macular degeneration. Then we have AI in cardiology. So you all might be familiar with Apple Watches and such, and Fitbits, which can actually monitor your ECG pattern continuously and give you alerts whenever there is an event. Such programs actually use AI to identify when there is a cardiac event. They can analyze ECGs, echocardiograms, and even cardiac MRIs. It can predict the risk of a cardiac event even before it occurs. And there have been many cases where devices such as this have saved lives due to prompt alerts. Another example of AI in cardiology is this ECG AI LEF algorithm, which was jointly developed by Mayo Clinic and Anumana. Anumana is actually an Indian startup, so they have a head office in Bangalore. So what they do is they analyze all the ECG patterns and they identify the risk for LV dysfunction. Identify LV function, and identify the risk for heart failure in the immediate future. They've seen that through RCT's randomized control trials, they've seen that there is a 31% increase in diagnosis without the use of echo using this AI program. And this is another paper which was published in 2024. So they have taken two ECGs, and the ECG on the left is before pacing was done, and ECG on the right is after cardiac pacemaker was installed. And you can see that the risk for low ejection fraction of heart failure have gone down significantly. It is able to identify that from the ECG. Then we have AI in oncology. Again, you can use AI for image tumor identification from the image, from CT and MRI data. You can also use AI to comb through the genetic data. Nowadays, whole genome sequencing has become more affordable, but it's very cumbersome to go through the entire genome, even for a single person. But AI can do it in a matter of seconds, and it is able to predict any precancerous genes which is there in the genome. You can also use AI for auto contouring, which is planning radiotherapy. So if we have a planned target volume in the center and we have organs at risk surrounding it, an AI planner is able to identify the best approach to give radiotherapy so that the organs at risk are spared and maximum radiation reaches the target volume. Then we have AI in surgery, which all of you might be familiar with robotic surgery. But one thing is that all robotic surgery need not have AI. Robotic surgery can also be just telesurgery, where systems like the Da Vinci surgical systems, which was approved way back in July 2000. So a surgeon will be controlling each and every action of the robot. So in that, AI doesn't have a major role. But nowadays, what we see is AI enhancements are there during surgery, where the AI will be able to recognize the anatomy, it will be able to guide the surgeon for the best approach, and even it can automatically suture the wound. So when such advancements are there in robotic surgery, that is AI in robotic surgery. AI can the second image that we see here is an example of a robotic arthroplasty machine. So this machine, after we feed it an CT, it is able to analyze the perfect position for the implant. Then during surgery, intraoperatively, we have to identify the landmarks on the bone, and once the machine has recognized the landmarks, the machine by itself does the cutting and drilling which is necessary for the placement of the implant. Then we can also use AI in a deep setting to analyze the workflow and improve the performance. As in, we can identify where there is a loss of efficiency, and we can improve we can reduce the time required for surgery. Then we have AI in psychiatry, where chatbots such as Bobot and Visa is able to deliver cognitive behavioral therapy without the need for a psychiatrist. Once the disease has been diagnosed and the plan is set, then the AI is able to deliver the therapy. We have speech and text analysis devices which is able to detect depression and psychosis. And then there is passive monitoring via smartphones, where we can detect relapse, which is chances for relapse. But all of these, there is always the concern for privacy and consent by the patient. So that is something that we'll discuss later on. Then we have AI in emergency and ICU setting. AI can very effectively triage patients in the ICU. An AI program is able to know all the whereabouts of all, not the whereabouts, the current situation of all the facilities that is available in a hospital, and it will be able to effectively triage the patient so that waiting times can be minimized. There are also AIs which use real-time vitals for event prediction before the emergency actually occurs. Then we have AI in preventive and primary care, where we can use huge data sets such as electronic health records, registry surveys, and social surveys to find patterns to predict who in the population is at the highest risk for a certain disease even before the symptoms occur, and we can give them preventive care. We can also use AI in management of chronic diseases such as diabetes, where you might have seen devices where you can implant a insulin delivery device, and it will automatically sense your blood glucose and deliver the required dose of insulin without any human intervention or doctor intervention. Then we have large language models in medicine, which all of you will be familiar with ChatGPT, and the one that we saw before was Google's Gemini. Such programs can answer clinical queries, it can generate notes for the doctor. Then we have prescription tools which can generate discussion notes and prescriptions from the doctor's voice. And an AI program again can be used to integrate all this to the hospital EHR system and improve the workflow. Then we have another domain which is still an upcoming area for research, which is multimodal integration. What we do here is we take data from imaging, genomics, lab, and even the consultation discussion reports, and we integrate everything to try and create a digital model for the patient. So what it essentially is a digital twin of the patient. So we can try experimental treatments and predict the outcomes, even though it sounds very far-fetched. Research is still going on in this domain, and this can enable very personalized and predictive care. And now we come to how AI actually affects doctors. So we should consider, at least in the current scenario, we should consider AI as a second opinion and a diagnostic tool. It is not a replacement for a doctor, and it is not able to give diagnosis as such, but it can be used as a diagnostic tool to help diagnosis. It can reduce clerical burden, where prescribing notes or discussions can be taken over by AI, and the doctor can focus more on clinical aspects. And the issue with integrating AI into clinical practice now is that doctors are not given any training on how to effectively use AI in the current system. So there is a need for new training regimes which can actually help doctors integrate AI better into their clinical flow. Another issue that comes up when in the discussion of AI is explainability and trust. So what is explainability? Is we are not able to identify why the AI has arrived at the output that it is given. AI nowadays, especially these deep learning models, the black box models, as you've seen before, it will have a number of hidden layers, and a person will not be able to identify all the weights that it has assigned to all the features and how it has arrived at the final output. So when we don't have the reasoning behind the output, we as doctors who are responsible for the safeguard of the patient find it difficult to accept it without the proper reasoning. So that is why explainable AI is a hot area for research nowadays. We use interpretable AI models which will actually give us a feature analysis which will show what feature is being used and how much importance is given to one feature, and then through this we will be able to explain why the model decided on the particular outcome. How we do this is using saliency maps or heat maps. So what it does is it will show which part of let's say for an image, heat map is more important. So it will show you what part of the image has contributed most to the diagnosis that it has arrived at. So if you look at this image, we can see that this part is red, and if you do a thresholding, we will see that it is marked an area which is the area where the tumor is actually located at. So in this way, we will be able to identify what features or reasoning the AI has taken to arrive at the particular diagnosis. Then we have explainable models which use feature importance. So this is what is called a sharp scoring, the second picture on the right. So what it does is, this is actually a model that I created, where it predicts heart failure risk from heart disease risk, from ST slow pulse, ST elevation, we have excess angina, then we have features like heart rate, chest pain. So when you input all these features into the model, it is able to predict the risk of a heart disease. So in this patient, for this particular patient, we see that patient had ST and ST slope elevation, and that has contributed most to the AI predicting that the patient is more likely to have a heart disease. Similarly, to evaluate the whole model, what we can do is we can put all these individual sharp scoring onto one graph. So the picture on the left that you see here is what's called a B-swarm plot. So such plots, all the features are represented on the left and the values are represented as high and low. So I'll give you one example to actually understand how this B-swarm plot helps. So this is actually a model which is predicting heart disease. And if you look at the feature of sex, you see sex is male and high means it's 1, that means the patient is a male, and low means the value is 0, so the patient is female. And 0 is median, that is 50-50 risk. And as we go to the right, we see that it's more risk for heart disease. If we go to the left, we see that it's less risk for heart disease. So if you look at only sex, we see that blue is female and red is male. So being male doesn't actually increase your risk for heart disease, but being female actually reduces your risk for heart disease, which is actually common knowledge that estrogen has cardioprotective function. So such features can be identified by putting together such sharp scoring to analyze why the program has actually arrived at the particular diagnosis. Then we have liability and accountability issues. So who is responsible for an error that AI has made? Is the doctor responsible or is the developer responsible? Currently, by all jurisdictions, clinicians still remains accountable for any decision that is made in patient care. That is because AI is not yet considered as an autonomous agent. So it is not qualified to make decisions, but it can only be used as a medical device and decision support system. So what can we do to safeguard ourselves? So the best advice is to document everything. So even if you are using an AI tool, you document that the AI tool has suggested this, and this is my reasoning behind trusting the AI, and these are features that actually support the decision support the results that the AI has given. So that is why this management has been opted for. And new proposals are coming up to create a joint responsibility model where the responsibility behind the decision or any liability is shared between the clinician, the developer, and the hospital. But those are still in the works, and as of now, clinician is responsible. Ethical considerations in AI. So we have to respect the autonomy of the patient. So a patient has the right to be informed if AI is being used in its care, in their care, and has to be informed, and an informed consent has to be taken. This is especially true in cases where we've seen, like in psychiatry, where we use chatbots. Nowadays, it's very difficult for us to identify if the person we are chatting to is a robot or an actual person. So if you are using chatbot in the treatment or in therapy or even in the prediction, we have to inform the patient or the person who is using it and get a consent. This transparency actually helps clinicians in a way such that the patient will be able to identify if some mistake has happened. The patient will be able to attribute it to the AI rather than blaming the physician for it. And finally, the clinician is still responsible for the well-being of the patient. So we have to make sure that the AI does not cause harm to the patient. So we have to always veto the AI's decisions and results before administering the treatment. Then there is this issue of bias and fairness. So what is bias? Bias is skewing of the data due to non-representative data. So one example that I have shown here is this. Both are cases of meningococcemia. So we can see that the rashes appear very different on fair-skinned individuals and in dark-skinned individuals. So if we train a model solely, or the majority of the pictures are light-skinned individuals, then if you use the same model in a population with mixed skin color, the model might fail most of the time, or whenever it is a dark-skinned individual, the model might fail. So there is this risk, and such risks actually increase the health disparity between different demographic groups. So we should always take care to audit the data that is being used to train the model and make sure that all diverse data is included in the training data. Then we have automation bias and privacy. So when there is a common notion that professors used to have is that people are going away from clinical diagnosis and they're relying more on investigations. A similar trend can happen here if there is an over-reliance on AI. It can erode the clinician's critical thinking and decision-making skills, and over time, a doctor might take the backseat in actually driving patient management. Then there is the issue of data breaches, misuse of data, and re-identification, because we use very sensitive personal data, patient data, for training AI models. So safeguard of that data is a very important priority. Then we'll briefly look at what the regulatory frameworks are that are already existing. So the principal organization that deals with regulatory frameworks is FDA, and currently there are around 1000 AI/ML based devices that are approved. And then when you use AI programs, most of them wouldn't have a physical hardware. It's not like a product or a device or a produce that FDA can approve. So now FDA has this pathway called software as a medical device, where you need not have a physical hardware, but it will still have to ensure all the regulatory standards such as safety, effectiveness, and quality before it is approved. Then one new law that has been passed by the European Union is this EU AI Act, which is binding for all all AI softwares that are used in Europe. So what they have done is they've categorized all the AI tools into 4 categories. There are unacceptable risk, high risk, limited risk, and low risk. And depending on what category it is, they'll have stringent regulations which the tool will have to prove that it is complying. Only then they'll be approved for use. Future is collaboration. So going back to the question of if AI will replace doctors, AI won't be able to replace doctors, at least not at the current level. But doctors who use AI will replace those who don't. And we see that there will be a shift of roles for doctors. They wouldn't have to figure out the differential diagnosis or write a prescription. Instead, they'll have to focus more on verifying the data that is fed to the AI. They'll have to build a rapport with the patient and communicate and reassure them better, and use the doctor's instinct and human judgment to actually supervise the AI's results and decide on the final management. So using AI in such a way, we can ensure faster and better care. Now coming back to the initial question, so is AI a hype, help, or a harm? So is AI a help? Definitely not, because AI is revolutionizing life as we know it, and healthcare is one of the most affected areas. And is it a help? Definitely, because there are multiple studies that have shown that AI and automating repetitive work can increase diagnostic efficiency and enable early detection of many diseases, especially rare diseases. And is AI harmful? There are definitely aspects which are harmful, but AI, much like a scalpel, is only a tool. It depends on how you use it. It's beneficial when applied correctly, but harmful if misapplied. Thank you. Thank you for listening. If you have any questions.
Thank you, Doctor, for the excellent speech. Now the topic is open for discussion.
How much is the risk of malware?
Artificial intelligence is a thing of the present.
Malware.
Okay. Yeah, malware is the risk is similar for any program that is there on the market. It doesn't increase when it comes to any healthcare application. We have banking applications and such where the risk is similar. So there are safeguards already in place to ensure that malware doesn't affect a software in general. So the same applies to AI in healthcare as well. That is there, the risk is present, but we have safeguards to reduce the risk.
Artificial intelligence is the thing of the person. There is no doubt about it. But I will ask you one question. Is artificial intelligence is a possible vision or whether it has got a
Sorry sir, can you repeat?
artificial intelligence, whether it has got a possible vision or a wide vision. For example,
Yeah.
an institute clinician who has come out from a reputed institute, when he examines a patient, he will have a diagnosis and he will get the diagnosis. Artificial intelligence will give a wrong diagnosis, right or wrong?
That is, I do not agree with that, because if the model is not sufficiently trained, it can give a wrong diagnosis. But a sufficiently trained model would definitely have seen more cases and more outcomes than any doctor who has recently come out of a medical college. Because it's not practically possible for a doctor to see as many cases that we can feed into a machine and for it to learn.
No, see, when you are coming out from a high volume center, you will have more expertise. There is no doubt about it.
See sir, I'll tell you, see, if there are 100 patients visiting a hospital which has 2 doctors, the 100 patients would be split between to the 2 doctors, so let's say 50-50. But for an AI, if there are 100 hospitals in a state, we can, or in a country, so we can get all the data from the 100 hospitals and feed it to the AI. So when you compare that to how...
I agree with that. When you said about artificial intelligence, I found out that 2 specialties are getting
More footfall.
one is pathology, one is radiodiagnosis.
I don't think so. See, don't call our specialty wise and don't degrade us.
But I was very happy. But anesthesia was not targeted.
So you shouldn't look at it as being targeted, sir. It's actually not targeting the doctors in the domain. It's actually a tool to help them. So they'll be able to provide better care if AI actually infiltrates their domain.
I agree. You see, people who are coming out of premier medical institutes, they start their training from 6th standard or 8th standard. Agree?
Yes. But that's not medical training.
Medical. Everybody, parents want their children to become doctors. Second is engineers. So you start your training from 6th standard to 8th standard or something like that, and you go to some training centers. You get into a medical school, reputed medical school. Okay, you come out. I also come out. No, not from a reputed medical school. But I have got artificial intelligence. So what is the difference between me and him?
So, artificial intelligence should be used by all doctors in the same capacity, and then artificial intelligence cannot actually give you a diagnosis. I mean, it can only give you the list of differential diagnoses. So from that, it is up to a doctor to actually elicit the clinical signs and symptoms and arrive at the proper diagnosis and supervise the management. So that you definitely need proper training from a reputed institute, a doctor.
I agree. But if this artificial intelligence is there, these people who are going into medical schools, yeah, artificial intelligence is there. Why should I burn my midnight noise?
No, sir, it actually increases the amount of importance for actually clinical examination. So, if everyone has access to artificial intelligence tools, even a patient will be able to identify his differential diagnosis by themselves.
I agree.
So,
For MBBS examination.
so
for an MBBS examination, when these artificial tools are there, why should I see whether it is intra-abdominal, intraperitoneal, and all those things? Artificial intelligence is there. I can show you.
AI cannot examine a patient by feel or touch. It's still only.
Diagnosis, solo anatomy.
But you can't always justify using a CT or an X-ray for a simple diagnosis that can be obtained by palpation. So the role of clinical diagnosis is always there, and AI only emphasizes it such that you don't have to memorize all the list of differential diagnosis that the AI will give you.
How the clinical, how these people, doctors who are coming out, how they have decreased their clinical skills?
You'll only increase the clinical skills where they'll not have to by heart all the list of differential diagnosis or symptoms, but they'll have to focus more on eliciting the clinical signs and symptoms and arriving at a diagnosis from the differential diagnosis.
I am a radiologist. See, recently I have prepared a topic for AI. From that, what I have understood is that usually among the worldwide radiology reports, 30% of reports are wrong. We are missing some important points by reviewing. Whether it is from AIMS or from Mayo Clinic or from Johns Hopkins, it is the same thing. Because I don't have a feeling that those who are coming from the good this thing is they are very good. Maybe they have got a good basic understanding. But when you are practicing, it depends on your sincerity, your effort, your future rise. So we are missing completely in radiology and as a doctor in casualty also. If the AI has got all the histories in his armamentarium, so it will give you. He had a CT scan recently. Or he had this thing. It will prompt you. This patient had this thing. So it's in the CT and radiology also. It will help us. Only thing is that it should not bypass us. So we should have some regulations that it should not bypass. That's what our Indian and all the prime minister and American all are telling. So it should be under our control. So we should try to understand AI. We should master it and we should use it for the advantage. Recently I am using it. I will feed all the findings what I am having. What the resolution is, what mass is, then it will give us a wonderful diagnosis. So what I have not, then I will read about that thing. Then it will make both things. So I am using a little bit using of AI because I think I have less intelligence. That's why I am using it.
Privacy of the patient.
Privacy concerns is there like any other software which collects sensitive data. So, but when it's AI for medical applications, we have more sensitive and more personal data. So we have to put more emphasis on safeguarding that privacy. You can look at it like any other bank application where the privacy concern is similar. So for that we have safeguards, but all of that should come to medical tech AI, which is the same effect as there is in financial softwares.
Nice talk. During my PG time, I used to use an application called UpToDate. So UpToDate is a paid app. It costs around 25,000 rupees per year. So most of the time, this app will be used by medical professionals only. So and I used to use another app for differential diagnosis. So if you feed multiple clinical symptoms into the application, it will give you the possible differential diagnosis exhaustive list. But that was also a paid app. So I used it in my final year during my ICU preparation time. But after that, I didn't continue it because it was a paid app. Now, during your talk, I downloaded the Grok app, Grok AI, and I just searched the same findings: fever, cough, rash, and lymphadenopathy. The Grok AI app gave me all the differential diagnoses I can think of, even the rarest one, in the beautiful order. And it is free, it is available to everyone. And if you type a medical question in that app, it is giving excellent answer that is not possible in Google. So previously in our clinical practice, what happens is a person or bystander will type a clinical question. They will get a rough idea from the Google, and most of the time it will be wrong, and they will argue with us. Now what will happen is that they will get a correct, excellent answer from the AI app, and they will question each of our steps, and they will be very well informed than most of us. So that's going to happen now.
Why these free apps might not be as good as a paid app is because these large language models such as ChatGPT and Grok, they are paid on a general data. It's not specifically for medical data. So they will similarly have less safeguards or fallbacks if it does make an error. So if it's a general tool that gives you an advice, it doesn't matter if it makes an error, but that is not the same for healthcare applications. So that is why most healthcare applications or tools in AI are pricier and paid applications.
In cardiology now there are a lot of applications for AI. Today we started AI integrated intravascular ultrasound. So it gives with a single pullback, it gives the automated lesion assessment. Otherwise you have to sit and calculate the lesion here to see whether it's a true lesion or not. They have fed thousands of patients data in there. And you can see whether it's a normal lumen or a lesion in the fatty plaque or a calcium plaque very beautifully in the lesion length with one pullback. I think that is a very highly advantageous for us in cardiology. Also, these other imaging is very useful. So, do you respect to any doubts?
You have said that there is artificial
One
intelligence.
second, I'll get back to you next.
Artificial intelligence doesn't have any medical legal
Liability.
Then what is the use of this artificial intelligence?
It is actually to help the doctor and the patient. We can ensure better care to the patient and we can reduce the workload at least for all these clinical.
But if I carry this artificial intelligence in a court of law, I am a person who has crossed around more cases of criminal cases in my career. Nothing matters unless and until you jot it down in your case sheet.
Exactly.
Nothing else matters.
Yes. So even in AI, documentation is of utmost importance and it can actually save the doctors from cases if the AI, it cannot save you, but it can actually show that the doctor is not entirely at fault and AI has a part in the fault, but even then the doctor is held responsible.
Thank you.
Sir? Yes, sir. Especially for nowadays, all the AI tools that are being developed are being developed with deep learning. So in deep learning architecture, what we have is we have a set of input layers, and there will be hundreds of hidden layers. And then finally, we have an output layer where all of this comes down to the classification that we actually want, or the diseases that we are looking at, or possible scenarios. So the way the model learns or is identifies which category this input falls into is by assigning weights to all the nodes. All the hidden layer will have hundreds of nodes. Each layer will have hundreds of nodes. So it will assign a weight to each of these nodes. So when a feature comes through all the input layers, it will go through all the nodes, and depending on the weights, some of them will fall down and some of them will be amplified, and finally we will see which of the classification has the highest rank or say probability, and that will be displayed as the output. So we do not know strictly what the model has done with the input that we have given. We do not know what the weights are that has been applied, that has been assigned to each of the nodes. So that is why we call it a black box.
Is it related to our plane crash black box?
No, it's not. It just means even in a plane crash black hole, we are not able to see what's happening inside until the plane crashes or we take it out. So in a similar way, we can only see the output. We do not know what's happening in between. That is why it's called a black box. Since there are tools which can help with cognitive behavioral therapy, I think it is possible that interaction with an AI, which is specifically designed to help improve the cognitive function in the patient, will definitely help. It can act as instead of psychotherapy.
No more questions, we can wind up this session. Before that, Talasheri IMA is planning to conduct IMA AMS Kerala State Chapter Non-Zone Conference on Sunday. Talasheri is here. He is the chairperson for registration committee.